Induced coma in ICU, why it's used and what families need to know. My name is Patrik Hutzel from IntensiveCareHotline.com, where we provide strategies and solutions for families in intensive care and where we instantly improve the lives for families of critically ill patients in intensive care. So you can make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always, even if you're not a doctor or a nurse in intensive care, so that you can instantly improve the lives for you and your family member in intensive care. So when your loved one is critically ill in intensive care, you may suddenly hear doctors say that they need to be placed in an induced coma. This term can be extremely frightening, and many families ask, what exactly is an induced coma? Why is it necessary? How long will my loved one stay in it? What are the risks and benefits? At IntensiveCareHotline.com, we specialize in consulting and advocacy for families of critically ill patients in intensive care. And here's what you need to know. So, what is an induced coma? An induced coma, also called a medically induced coma or barbiturate coma, is a controlled state of deep sedation in ICU. Strong medications such as propofol, midazolam, or barbiturates are used to deliberately reduce brain and body activity. Unlike a natural coma caused by illness or injury, an induced coma is carefully managed by ICU doctors. It can be started, monitored, and reversed depending on the patient's condition. So why is an induced coma used in ICU? Doctors may recommend an induced coma for several reasons. Why it matters: to tolerate a ventilator. A breathing tube and ventilator can be very uncomfortable. Deep sedation prevents distress, agitation, or removal of the tube. Next, to protect the brain. Reducing brain activity lowers oxygen and energy demand. Useful after brain injury, seizures, or swelling to control severe agitation or pain. Helps the patient rest and heal when less intensive measures are not enough. To allow complex treatments, for example, in cases of severe ARDS, also known as lung failure. Induced coma allows therapies like prone positioning or ECMO. Next, let's look at risks and complications of an induced coma. While often life-saving, an induced coma comes with risks: delirium and confusion after waking, muscle weakness from prolonged immobility, infections as sedation may extend ventilator use, low blood pressure requiring medications, difficulty weaning from sedation if the body becomes dependent. Families must understand that the longer the induced coma continues, the higher the risks become. How long will my loved one stay in an induced coma? There is no single answer. The duration depends on the underlying illness, i.e. pneumonia, brain injury, ARDS, and the list goes on. How quickly a patient stabilizes, the ability to wean off the ventilator, neurological response when sedation is reduced. Some patients stay in an induced coma for a few days, others for weeks. ICU teams typically perform sedation breaks or sedation holidays, also known as sedation vacation, daily to check brain function and assess readiness to wake up. Let's look at the family advocacy part of things and questions to ask the ICU team. As a family, you have the right to clear answers. Here are some key questions to raise. Number 1, why exactly is my loved one in an induced coma? Number 2, what medication is being used and at what dose? Number 3, are daily sedation breaks being performed? Number 4, what is the plan for waking them up? Number 5, what risks apply in my loved one's case? Options beyond ICU might be intensive care at home, if your loved one remains ventilator dependent with a tracheostomy and requires prolonged sedation or complex care. Have a look at intensivecareathome.com, which provides a safe alternative. Specialist nursing care can often be delivered at home, avoiding long-term ICU or LTAC stays and allowing your loved one to recover in a familiar home care environment. Let's quickly look at key takeaways before we wrap this up. An induced coma in ICU is a controlled medical intervention designed to protect your loved one during critical illness. While it comes with risks, it can be life-saving and allows essential treatments such as ventilation, brain protection, and advanced therapies. As a family, your role is to ask questions, understand the goals of sedation, and ensure there is a clear plan for waking your loved one when it's safe. With the right ICU support and advocacy for families, patients in an induced coma can have best chance of recovery and, where possible, transition to home-based care when prolonged ventilation and tracheostomy is needed. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.